Hello guys, welcome to my channel. Don't forget to like, comment, and subscribe. You can also follow us on Instagram with the same name, ABG. Right. So the video in focus today will be looking at the anatomy of the brachial plexus. We'll actually be looking at the nerves that are actually going to be making up the brachial plexus, as well as the structures that they'll actually supply. Right. So if you look at the brachial plexus, it's going to be formed from union of the ventral rami of the lower four cervical nerves, that is C5, C6, C7, and C8, as well as T1. And in some cases, you may have what is known as a prefixed and a postfixed brachial plexus, which will include C4 and T2 respectively, right? And if you look at the brachial plexus, it's going to have what are known as the roots, that is your C5 to T1. Then you have the trunks, then you have the divisions, then you have the cords and the terminal branches, which you actually going to be going to supply the structures within the upper limb, right? So from the roots here, you can appreciate that C5 and C6, they join to form the superior trunk, which is this one. Then if you look at C7, it continues as the middle trunk. Then this is going to be C8 and T1 joining to form the lower trunk or your inferior trunk, right? And each trunk is then going to divide into an anterior division and a posterior division. If you look at the posterior divisions of all the trunks, they're going to join and form what is known as the posterior cord, which is this one, right? Then the anterior division of the superior trunk, which is this one, will join the anterior division of the middle trunk, and they're going to form the lateral cord, which is this one. Then the anterior division of the inferior trunk will actually continue as the medial cord, which is this one. Those cords are so named in relation to their arrangement to the second part of the axillary artery. And remember, all three cords, they lie above and lateral to the first part of the axillary artery, right? So coming back to the roots, which you're obviously going to find in the neck, right? And then the trunks, you find them somewhere behind the clavicle and also in the neck, then as well as the divisions, then the cords will now be in your axilla, right? So if you look at the roots, you're going to have two branches that are going to be coming from the roots. You have the long thoracic nerve, which is going to be having nerve roots C5, C6, and C7. This long thoracic nerve will actually course behind the parts of the brachial plexus as well as your axillary vessels, and it's going to be moving on the lateral margin of the first rib. And remember, this nerve is going to supply the serratus anterior muscle, right? Injury to this long thoracic nerve will result in a winged scapula, right? Then if you look at another branch that will be coming from the roots, that is only C5. It's going to be this nerve here, which is your dorsal scapular nerve, right? The dorsal scapular nerve will only have nerve roots C5 and, right? And if you also look at C5, there's a contribution to the phrenic nerve, which is this one, which is usually described as a contribution that will be coming from the nerve to the subclavius. So when you then want to perform a phrenic nerve block to induce partial or hemiparalysis of one of the domes of the diaphragm, you may also need to have infusion of the anesthetic in this region for you to actually deal with this contribution to the phrenic nerve, right? This dorsal scapular nerve will innervate the levator scapulae as well as your two rhomboids. You have a rhomboid major and a rhomboid minor. Those muscles entirely, they're actually on the vertebral column, and they'll be going to attach onto the scapula. If you remember the origin of your levator scapulae, it's going to be originating from the transverse processes of the first 4 cervical vertebrae. Then if you look at the rhomboid major and the minor will originate just above the major, and they'll be coming from the cervical and the thoracic vertebra, and they're actually all going to attach onto your scapula. That is the medial border of the scapula, right? They'll be innervated by this dorsal scapular nerve, right? Then when we get to the trunk region, we have 2 branches that are actually coming from your upper trunk. You have the suprascapular nerve, which is this one, right? Then you have the nerve to the subclavius, which is this one, right? The suprascapular nerve will innervate 2 muscles. The nerve to the subclavius, from its name, nerve to the subclavius, it will actually innervate your subclavius muscle, right? Then if you look at the suprascapular nerve, it will innervate the supraspinatus and the infraspinatus muscles, which are actually going to be originating from the supraspinous and the infraspinous fossa respectively. And they're actually going to be part of the rotator cuff muscles, and they're all going to insert onto the greater tuberosity, right? Then that's the trunks. Then you're not going to have any branches coming from the divisions. So we can now then trace the medial cord of the brachial plexus, right? Which is going to be this one, right? From this medial cord, we can appreciate that we have the medial pectoral nerve, right? Meaning to say, from the lateral cord, you'd also expect a lateral pectoral nerve. These pectoral nerves will actually be going to the pectoral region, and they are going to pierce your clavipectoral fascia, right? And they're going to be supplying the pectoralis muscles. Remember, you have the pec major and the pec minor, right? Then also emerging from the medial cord, you have the medial cutaneous nerve of the arm, as well as the medial cutaneous nerve of the forearm, right? But if you look at the lateral cord, there are no such branches. I'll explain why, right? When we then look at the axillary nerve and the radial nerve, right? So from the medial cord, you have the medial cutaneous nerve of the arm, as well as that for the forearm. They're going to be innervating the skin on the medial aspect of the arm and the forearm respectively. And the medial cutaneous nerve of the arm, it's going to be reinforced by the lateral cutaneous branch of T2, which is going to be the intercostal brachial nerve. If you look at the thoracic nerves, you realize that only T3 to T6 are typical thoracic nerves. If you look at the first one, it's going to the brachial plexus. Then if you look at the second one, its lateral cutaneous branch is actually going to supply the skin of the medial aspect of the arm, particularly the axilla. That is going to be the intercostal brachial nerve. Then if you look at T7 all the way down to T12, those nerves will not be confined to the thorax. They will also supply the abdominal region, right? That's that, right? Then you find that the terminal branches of the medial cord are going to be this medial division of the median nerve, as well as the ulnar nerve, which is this one, right? So we can now go on the ulnar nerve a bit. The ulnar nerve, it's going to course in the arm, and it's going to be found in both the anterior and the posterior compartments. Halfway down the arm, this ulnar nerve will pierce the medial intermuscular septum together or in company with the superior ulnar collateral vessels, and it's then going to go to the posterior compartment. And within the posterior compartment, it's then going to emerge behind the medial epicondyle. Then it's going to pass between 2 heads of a muscle that it's going to supply in the forearm, which is going to be your flexor carpi ulnaris. Then as it courses in the forearm, it's going to lie between 2 muscles that it supply in the forearm. That is, you're going to have the flexor carpi ulnaris above, then you're going to have the medial half of the flexor digitorum profundus beneath. And at the wrist joint, it's then going to emerge just lateral to the pisiform bone, right? But if you look at the relationship of the ulnar nerve and the ulnar artery, you'd find that the nerve will actually be medial at your wrist joint, right? Then it then goes into the hand. And if you look at the ulnar nerve in the hand, of the 20 muscles that you actually find, the ulnar nerve will innervate 15 muscles, and maybe we can say 16. Because of the 5 muscles that are going to be supplied by the median nerve, you have 3 of the thinner muscles and the first 2 lumbricals. But if you look at the flexor pollicis brevis, which is one of the thinner muscles, it's going to be innervated by both the median nerve and the ulnar nerve, right? So this medial division will then join the lateral division from the lateral cord, and they'll form the median nerve. We'll talk about the median nerve. But the ulnar nerve, it's going to be having nerve roots C8 and T1. And in some cases, you may have contributions that are actually going to be coming from C7. Then from the lateral cord, we've talked about the lateral pectoral nerve. Then the terminal branches of the lateral cord will be the musculocutaneous nerve and the lateral division of the median nerve. If you look at the musculocutaneous nerve, it's going to pierce the coracobrachialis muscle, which it supplies. Then it's going to lie between the 2 other muscles in the arm that it's actually going to supply. That is going to be the biceps above and the brachialis beneath. And towards the elbow joint, it's going to emerge between the biceps and the brachioradialis muscle, which is actually a muscle of the lateral compartment of the forearm. And you're going to find that it's then going to change name to become the lateral cutaneous nerve of the forearm. So from its name, musculo, it is supplied the coracobrachialis, the biceps brachii, and the brachialis muscle itself, despite the fact that the brachialis is a jaw innervation also coming from the radial. Then it's going to end by becoming the lateral cutaneous nerve of the forearm, right? The medial cutaneous nerve of the forearm, we have just said that it's coming from the medial cord, right? Then the median nerve is this one, right? It is contributions that are coming from both the lateral cord and the medial cord. And if you look at the median nerve and the radial nerve, they're going to be the only 2 nerves that are going to be formed by the brachial plexus that have contributions from all the roots C5 to T1, right? So the median nerve will actually start lateral to the brachial artery, and halfway down the arm, it's going to cross and it's actually going to become medial. That is why in supracondylar fractures of the humerus, you can have the median nerve being affected together with the brachial artery, resulting in that Volkmann's ischemic contracture, right? So the median nerve in the arm, it's going to give you a vasomotor branch that is going to supply your brachial artery, right? Then it's going to course within the cubital fossa as the most medial structure. Then it's going to pass between 2 heads of a muscle that it's going to supply, just like the ulnar that we said was going to pass between the 2 heads of the flexor carpi ulnaris. The median nerve will actually pass between the 2 heads of your pronator teres, which is actually going to be a muscle that forms some of the boundaries of the cubital fossa, and it's a muscle of the anterior compartment of the forearm. So basically, it's a flexor, right? It's part of the flexor compartment, but it pronates, right? Then this median nerve is going to supply all the muscles of the anterior compartment of the forearm, except the flexor carpi ulnaris that we said was innervated by the ulnar nerve, as well as the medial half of the flexor digitorum profundus that is actually being innervated by the ulnar nerve. And interestingly, the median nerve will lie between the flexor digitorum superficialis above and the flexor digitorum profundus beneath. Remember we said the ulnar nerve will actually lie between the flexor carpi ulnaris above and your flexor digitorum profundus beneath. And it's going to give a branch that is your anterior interosseous nerve. This anterior interosseous nerve, it's going to be the nerve that is going to supply the muscles of the deep group of the anterior compartment of the forearm. Right. Then the median nerve will pass beneath your flexor retinaculum, and it's going to be beneath the tendon of your palmaris longus. Then it can be entrapped there. And always remember that both the median nerve and the ulnar nerve, they are going to give you their palmar-cutaneous branches before they actually cross the flexor retinaculum. That is important to remember when you look at the clinical correlates in nerve entrapments. For example, if you're going to compress the median nerve at the wrist joint, you will not lose skin sensations on the palmar aspect. But then you actually lose skin sensations on the digits now, because the branch the digits, it's given after that. Right. So the median nerve in the hand, it's then going to supply the three thinner muscles as well as the first two lumbricals. And if you look at the sensory innervation of the hand, the skin on the lateral 3.5 on the palmar aspect, it's the median nerve. That on the medial 1.5, it's actually going to be the ulnar nerve. The same story is seen on the dorsum. The medial 1.5, it's still the ulnar nerve, but the lateral 3.5, it will actually be the radial nerve, which we are now about to discuss. Right. So coming now to our posterior cord, this is going to be the posterior cord. It's going to have the lower subscapular and the upper subscapular, and between them there is a mid-subscapular, which alternatively can be referred to as the thoracodorsal nerve. The thoracodorsal nerve will innervate the latissimus dorsi, right? Then the subscapular nerves, both of them, they'll actually innervate your subscapularis muscle, which is actually going to be in the subscapular fossa of your scapula, right? Then if you look at the lower subscapular nerve, it's also going to innervate your teres major muscle. The minor one will be innervated by the axillary nerve, which we are now about to discuss, which is this one. The axillary nerve is one of the terminal branches of the posterior cord, and it's going to supply two muscles. That is, it's going to supply the teres minor as well as the deltoid muscle, which forms the prominence of the shoulder, right? Then if you look at the skin on the lateral aspect of the arm, the skin over the upper half of the deltoid will be innervated by supraclavicular nerves that are actually coming from the cervical plexus in the neck. They're going to be having nerve roots C3 and C4. Then the skin over the lower half of the deltoid in the sensory pavement area, it's going to be supplied by what is known as your upper lateral cutaneous nerve of the arm. Then the rest of the skin on the lateral aspect will be innervated by the lower lateral cutaneous nerve of the arm, right? The upper lateral cutaneous nerve of the arm will be a branch of this axillary nerve. Then the lower lateral cutaneous nerve of the arm, as well as the posterior cutaneous nerve of the arm, they're going to be branches of this larger, more terminal branch of the posterior cord, which is your radial nerve. The radial nerve will be the nerve of the posterior compartment of the arm, the posterior compartment of the forearm, as well as the lateral compartment of the forearm, and it will also innervate the skin on the lateral 3.5 on the dorsum of the hand, as I said earlier on. So it's going to innervate your triceps. Then within the cubital fossa, you're going to see it divide into a superficial branch and the deep branch. But before it actually divides, it's going to innervate the anconeus muscle, as well as the brachioradialis and the extensor carpi radialis longus. Then it will divide into the superficial branch, which is the more direct continuation that is going to supply the skin. Then the deep branch will innervate the supinator muscle, which it will actually pierce through in the floor of the cubital fossa. Then it will also innervate the extensor carpi radialis brevis. Then it's actually then going to be known as the posterior interosseous nerve. Then it will supply the rest of the muscles in the posterior compartment of the forearm, as well as your radioulnar joints, that is the proximal, and the distal one, right? So this is more like a summary of what we have just described. This is the long thoracic nerve, C5, C6, C7. It's going to the serratus anterior muscle. This is the dorsal scapular nerve. It's going to the rhomboids and the levator scapula. This is the nerve to the subclavius that is coming from the upper trunk. It's going to the subclavius muscle. This is the suprascapular nerve. It's going to the supraspinatus and infraspinatus. Then the divisions of no branches. Then we go to the cords, lateral pectoral nerve, medial pectoral nerve. They're going to the pectoral muscles. Medial cutaneous nerve of the arm and the forearm. They're going to the arm and the forearm respectively. Then this is your ulnar nerve to supply most of the muscles of the hand, as well as two muscles in the forearm. That is your flexor carpi ulnaris and the medial half of the flexor digitorum profundus. Then this is your upper and lower subscapular nerves. They will supply the subscapularis muscle. Then this is your thoracodorsal nerve. It will supply the latissimus dorsi. Then this lower subscapular nerve, it will also supply one of the teres muscles, which is your teres major. Then this is the axillary nerve. It will supply the deltoid and the teres minor. This is the radial nerve. It will supply the muscles of the posterior compartment of the arm, which is going to be your triceps. Then it will also supply the muscles of the lateral compartment. That is going to be the brachioradialis and the extensor carpi radialis longus, as well as the muscles of the posterior compartment of the forearm. Right. Then this is the medial nerve. It will supply most of the muscles of the anterior compartment of the forearm, except of course your flexor carpi ulnaris and your medial half of the flexor digitorum profundus. Right, and we supply 5 of the muscles of the 20 muscles actually that you find within your hand. Right. Then if you look at some clinical correlates that are going to be associated with this, you can have what is known as Ebbs palsy. If you have a lesion in the upper roots, then you can have Klumpke's palsy as a lesion in the lower roots. Then the radial nerve can be injured in the radial groove and you can get a wrist drop, but you'd find that just after the elbow joint, you won't get a wrist drop because the nerve to the brachioradialis would have already been given off, right? Then an ulnar nerve injury would result in a claw hand mainly. Then a median nerve injury will result in an ape hand. Right. Then another muscle that you find associated with the upper limb that will not be supplied by this brachial plexus, it's going to be the trapezius muscle. That is, of course, going to be supplied by the spinal part of the accessory nerve. So I hope you enjoyed watching. Don't forget to subscribe, like, and comment. Pleasant viewing.